I think Hodgkin lymphoma is an ideal model because it has been a success story in terms of anti-PD-1 checkpoint blockade, and it's one of the diseases where this actually works very nicely. And what we are understanding in this disease is that there is a complex interaction between the malignant cells and also the tumor microenvironment that is providing a protective niche for these malignant cells, and we are disturbing this by anti-PD-1 blockade. And there seem to be several mechanisms involved, and one could be a CD4-mediated like cytotoxic effect that's dependent on antigen recognition, such as in solid tumors. However, there seem to be other effects also involved, since many recent trials could show that there is a rapid histologic remission upon initiation of anti-PD-1 blockade in Hodgkin lymphoma. And this is something that is somewhat unique and also sheds light on mechanisms of anti-PD-1 checkpoint blockade beyond the conventional cytotoxic T-cell mediated effects. And I think to this end, it's very important that we try to understand mechanisms of action and resistance, and Hodgkin lymphoma can serve as a model for this, since we are increasingly gaining insight on the complex composition of the tumor microenvironment and also other immune checkpoints beyond PD-1, PD-ligand-1 that are expressed and seem to shape this tumor microenvironment. And this is, for example, LAG3, but also TIM3 or ICOS. And in Hodgkin lymphoma, there seems to be a co-expression of these checkpoints within the tumor microenvironment, both on the tumor level, on the tissue level, but also on the peripheral blood, where we see that the circulating lymphocyte population before any kind of treatment has a very exhausted phenotype that is then rapidly reversed upon anti-PD-1 blockade. And by dissecting these mechanisms of action, but also co-expression patterns of checkpoints, I think we are able to provide a blueprint that could be used for other lymphoid malignancies or other cancers to come up with strategies how we can basically open the door for immune checkpoint blockade also in these cancers where it might not work as well as in Hodgkin lymphoma so far.